something that we do quite often are prenatal exams. And after that first visit with your patient, patients will know to come to the front about 15 minutes before their appointment, 10 to 15 minutes before their appointment, and come to this desk up here and they weigh themselves. And it's a pretty self-explanatory scale, and there are scales in each of the hallways. Just to make sure you turn it on and adjust it to kilograms. So wait for it to set, adjust it to kilograms, and then they'll remember that number and they'll go to the bathroom. So that's the next thing they need to do in their prenatal visit. So after the patients weigh themselves, they'll go through any of the hallways, especially whichever one that they typically are familiar with. And in each hallway there is a restroom that's well demarcated, and each restroom has a specimen container as well as urine dipsticks, which they will know what to do with, and I will show you what to do. So in each of the restrooms, there are specimen container and urine dips, and these just check protein and glucose. So once they do that, they write down with a pen whether there was negative protein trace or whatever number it suggests for the protein. Glucose is negative or whatever number they get. And on the back, they write the weight that they had taken for themselves at the front. So once the patient's out of the restroom, they will just sit in the hallway or sit in the waiting room waiting to be called. Before they come in, the things you need to bring into the room for the patient appointments are the fetal heart monitors, as well as some jelly, ultrasound jelly. So the only other thing you would need for the antenatal visit is found in the top drawer of the bed, and that is the tape measure, which is used to check the fundal height, as well as the blood pressure cuff. And both of these, along with the glucose, weight, and protein, you would enter into the antenatal record.